Our first interview is with Janice Dawson, the CEO at Erie Shores Healthcare. Welcome to the show, Janice.
Good morning, Rob. How are you this morning?
Terrific. First question is always, how are you and your family doing through this?
Thanks, Rob, for asking. We're doing well, actually. It's been a bit of a kind of getting used to the new normal, I guess, is what it's being called. However, my husband is retired, so staying at home and staying away from the public hasn't been too difficult for him. But we certainly miss our kids who haven't been able to visit.
Yeah, I think the kids and grandkids are the most difficult part of this for parents. How has COVID-19 affected Erie Shores Healthcare?
Yeah, so COVID-19, we've been, over the course of the last 4 weeks, really putting in some protocols and changing some of our practices to comply with some of the public health guidelines and directives that have been coming out. So we've been working very hard over the last 4 weeks to make sure that we have those in place and getting prepared for the surge, as it's being called, and when that might actually hit us. Our management team has been working around the clock, educating staff. We've been retrofitting various rooms, creating capacity within the organization, and unfortunately have had to make some difficult decisions around visiting restrictions and ramping down some of our services. But I'm very confident with the team's work that has been done that we are very well prepared and ready in the event that we do see an increase in the number of patients coming in.
With that, and you talk about capacity, how is your capacity now, and are there plans if you need more? How do you fill that?
So our capacity right now isn't too bad. We've seen a little bit of an increase over the last 3 or 4 days. We're sitting at about 50% right now. We've created some capacity early on a few weeks ago. We partnered with Hotel Dieu Grace Healthcare in Windsor, who does some specialty work around rehabilitation services. They were generous enough to take our rehab patients at the time, so we decanted all of our rehab patients to Windsor. That allowed us to take those 12 beds and designate them as acute care beds. In addition to that, we've opened up another 10 additional beds. We've created a second ICU so we can separate our COVID patients from our what I'll call clean patients coming in that still require that level of service. And we're just in the planning phases of creating about another 30 beds within the hospital using some unconventional space and relocating some areas of clinics or diagnostics or those type of things. If we got to a situation where we were still running out of capacity, we would then look at potentially opening up some beds outside of the hospital and are working with our municipality on doing that in the event that we need to do it. But we've got our fingers crossed it won't get that far, and that would certainly be a last resort.
Healthcare workers, they're doing a tremendous job, and we all need to tip our hat to them. How is your supply of PPEs?
So that seems to be kind of one of the hot topics out there. Certainly, we are monitoring our PPE on a daily basis. We have some concerns, as we are hearing, both from our suppliers and from the folks that are doing our procuring, that there is some sort of shortages, particularly around the N95 masks. So we're working very closely with them on making sure that our supplies are where they need to be. Right now, we have about a 3-week supply, so we're not too bad, but certainly it's something we're monitoring very closely, particularly around the N95 masks, and we're working very closely with them as well as the province on procuring some more of those and making sure that we've got an adequate stockpile, particularly if we start seeing that increase in patients.
How can people help? I know that there's been some donations. Is there drop-off areas, or do they have to be a certain a type of PPE that they would require?
Yeah, so it's a great question, and I have to say our community has been amazing in coming forward with donations of PPE or even some handmade PPE. We're always looking for those N95 masks. We've had some folks in the area hand sew some face masks, as well as the operating room caps and some gowns, even scrub tops for our staff to ensure that they are protected. There is, certainly we have to maintain that standard of care with the PPE that's coming into us and those requirements that Health Canada have put in place to make sure that we're using the appropriate PPE. Certainly, we welcome any donations. Hand sanitizer, those masks and caps and gowns are certainly welcomed.
And would they just simply contact the hospital, because you don't want them showing up, right? To make her.
Exactly. So if anyone has any donations, they can contact our Director of Communications and Public Relations, Arms Boomenlog, and his contact information is on our website.
And the website is?
www.ldmh.org.
Excellent.
That was probably the hardest question.
Tell us about, you talked earlier about a little bit about visitor restrictions, and how was that going, and what are the visitor restrictions there?
Yeah, so early on, again, we started looking at who was coming into the building and why people were coming into the building, and certainly we recognize that we want to keep our patients safe, we want to keep our staff safe, but we want to keep it safe. So it was important for us to establish some of those visiting restrictions early on and kind of work from that starting point. Unfortunately, we have had to implement some further restrictions than when we first started. We are only allowing one visitor for palliative type of patients or end-of-life patients, as well as one visitor with some of our moms who are giving birth. There is some exceptions that will and can be made with some discussion with the administrative team and the physician who's caring for the patients. So this was a really hard decision that we had to make. Certainly, we recognize that part of the care of a patient is having their loved ones with them to support them. So, and particularly at end of life. So this was not an easy decision to make, but one we felt that was necessary to protect our staff, patients, and our community.
Yeah. Is there a line of communications between yourself regionally with our hospitals and also provincially?
Yes, we actually have a very strong working group, both locally, regionally, and provincially. So locally, all 5 hospitals within what was formerly known as the Erie St. Clair Lynn region. So that includes Chatham, Sarnia, Windsor, both Windsor Regional Hospital, Hotel Dieu Grace Healthcare, and ourselves. We're meeting twice a week to have these conversations around what's happening locally, where we can assist one another, where there may be some concerns rising in various areas, and how we can help one another to ensure that all of our communities are being taken care of, and we have the ability to do so. From there, David Mouget, CEO of Windsor Regional, represents our region at a Ontario West table. His job there is to escalate any concerns here, and then from there it filters up to a provincial level. So we have a really good open communication right up to Queen's Park, and then back down here locally to our area.
One question that's been brought up that I've been asked is, with COVID-19, and people kind of know the symptoms of that, but when should you go to the emergency department when it's not a COVID-19, and is it safe to go there, and what should people do?
Yeah, that is a really good question, Rob. One of the things we don't want to see happen is people not come when they absolutely do need to come. So although I understand that and can certainly appreciate there's a lot of fear and anxiety about coming to the emergency department if you are not well, there are times when absolutely you do need to come to the emergency department, and we don't want you to wait, particularly if you're having any type of cardiac symptoms, difficulty breathing, extreme pain. We need you to come, and we've got processes and protocols in place that will keep you safe. We've got rooms established, separate rooms, so that you would not be in the same room as anybody who would be experiencing any types of symptoms. Our numbers are generally low in the emergency department right now, so certainly our wait times are next to nothing. So we would definitely make sure that you're in, get seen, and then get you to where you need to be with those type of illnesses. But we do want to stress, don't wait. If you are experiencing some significant illnesses or symptoms, make sure you come in and see us.
Excellent. Lastly, how is the morale of the staff doing?
Yeah, that's a question that we ask ourselves every single day. We acknowledge and certainly appreciate that there is fear and anxiety amongst our staff out there, and we're doing everything we can to support them and make sure that they have the tools and resources to doing their job. But undoubtedly, these are frontline workers who are walking into work every day, not really knowing what to expect, as well as having to deal with some of the issues of their own home and their own family and being separated from their family and loved ones. So it's really important that we continue to support them and acknowledge those fears and anxieties. Some of the things we've put in place to help support them is we have an employee assistance program, which is essentially a number they can call to talk to somebody, whether it's about how they're feeling or their financial situation or looking for other type of supports. We have that in place. We have our own internal peer support, which is actually some of our frontline workers who have been trained to offer some of those type of supports. And sometimes it's nice just to talk to somebody who's actually living it with you. And lastly, our spiritual care committee has been just excellent in offering their services. So we're doing what we need to do to make sure our staff are feeling safe and feel supported as we work through this unprecedented time.
Well, Janice, make sure you give them our heartfelt appreciation. Everyone here at Your TV, my wife is a nurse, and they are really going through a difficult time, and we just wish them all the best and thank them. And I think a little thank you is always appreciated by them.
Thank you, Rob. I will most certainly do that.
Thanks, Janice. I really appreciate your time, and stay well and stay safe.
Thank you, Rob.
That was Janice Dawson, CEO of Erie Shores Healthcare.